The point which I want to highlight, don't look in the pelvis for ganglion, which is parasympathetic ganglion. Have you heard of, when you are studying anatomy of the pelvis, that there are parasympathetic ganglion there? There's hypogastric ganglion, but every ganglion is not parasympathetic. Some of them are sympathetic, and hypogastric is sympathetic. Then intramural, the very long preganglionic fibers, very short postganglionic fibers. Is that clear? No question? Okay. And there's no fun in telling that these fibers are concerned with motor to last part of GIT leading to defecation, and to the bladder they will lead to micturition, and for the genital activity in the male, parasympathetic activity will lead to erection, and in female that will lead to vaginal secretions, right? Innervation of urinary bladder. It is an example in which we learn how sympathetic, parasympathetic and somatic nervous system, all of them coordinate, right, to do two functions of the bladder. Number one, that bladder is very much master in filling properly and retaining the urine until you are able to find a proper place, and then bladder can lead to evacuation of urine. Now, how the nervous system coordinate all these things? So, we will draw first of all bladder over here. Let's suppose here is urinary bladder, and in this urinary bladder there is a muscle which is present over here, and this muscle is called detrusor. It is actually smooth muscle, and this is a very special type of smooth muscle. Detrusor is a very special type of smooth muscle in which smooth muscle are connected with each other with very high number of electrical communication systems which are called gap junctions. Again, let me repeat it. Detrusor is a network of smooth muscles which envelop the body of the urinary bladder. It consists of millions of smooth muscle fibers which are interconnected with such junctions through which electrical impulse can pass, jump from one cell to the next cell with low resistance. Due to that reason, whenever detrusor contract, it contracts as a single unit. You cannot say that anterior part of my urinary bladder is contracting and posterior is not contracting, or you can't say that right part of the urinary bladder is contracting and the left is not contracting. Bladder contracts as a unitary system, number one. Number two, a part of the bladder smooth muscle which is present over here, right, this act as a internal urethral sphincter, right, this is internal urethral sphincter, right, and below this of course there are some pelvic muscles, you know. For example, if this is a pelvic floor muscle, what could be this muscle? Yes, please. Levator. Yeah, pelvic floor muscles, and then here maybe this is membranous part of urethra which is passing through this area, and there is a very special type of sphincter present over here, and this sphincter, yeah, this is external urethral sphincter. So we can say this is internal urethral sphincter and this is external urethral sphincter. One thing which is a very big difference in the internal urethral sphincter and external urethral sphincter is that internal urethral sphincter is working automatically, involuntarily, and external urethral sphincter is working under voluntary control. External urethral sphincter is working under voluntary control. Now let's draw the spinal cord here and let's talk about the different levels of spinal cord. Let's suppose this is sacral area, suppose as 2, 3, 4, and another segment I represent here, and this is lower lumbar area. Suppose L1, 2, 3, right? And of course, when spinal cord goes upward, right, it will eventually reach, yes, medulla, then into pons, then into midbrain, and then there are higher centers, of course, yeah, cortical areas. Now this represents your central nervous system. Of course, not a very anatomical diagram, but it helps you to understand. Let me tell you, this is sacral area of the spinal cord. Here it is the lumbar area of spinal cord. Then this present thoracic and cervical, and then there is medulla, pons, and higher centers, right? Now we have to see, first of all, let's start with it. You are taking lecture right now, and suppose you have emptied your bladder before the lectures. Of course, when you are taking this lecture and you are sitting over here, kidney is constantly producing urine. Is that right? GFR is, glomerular filtration is going on, tubular reabsorption is going on, tubular secretions is going on. In every minute, about 1 ml urine is produced on average, right? Now what really happens? That urine is passing through the ureters to the urinary bladder, and urinary bladder is right now behaving as a container to store the urine, right? When urine will, let's suppose, reach to the urinary bladder up to the amount of about 50 ml or 60 ml, you may feel initial, some of you may feel initial urge to void, but because lecture is continuing, you can postpone it, right? But as time will pass by, more and more, suppose lecture become very long, more and more urine is appearing into bladder, pressure in the bladder should go up, but actually it does not. Something unusual occur. What is that? That as amount of the urine keep on increasing in the bladder, right, ideally tension in the wall of the bladder should increase, and ideally pressure within the viscus should increase. But something occurs very beneficial, that as urine amount keep on increasing progressively, bladder keep on increasing its size. Due to that reason, in spite of increasing the volume of urine within the bladder, as with increasing volume of the urine, bladder keep on stretching itself, it does not increase the pressure within the bladder significantly, right? Let me draw a graph here. That let's suppose this is the, you are measuring the pressure. Bladder was empty, there was no pressure. Suppose pressure is on this side and volume is on this side. Now what really happens? Initially there was no volume. As volume started going up, pressure started. But then as time is going back, time is passing by, volume is progressively increasing, but there is no significant rise in pressure. This part of the curve is called 1A and this is called 1B. Now what is really happening in this part? As time is passing by, volume of urine is increasing, but pressure in the urinary bladder is not increasing. Is that right? Until it reaches about 400 ml, when there will be very strong, you can say around 400 ml, very strong urge to void, right? And then maybe you pressure start going up, and if you really decide to micturate, naturally micturation process, the tussle will contract and pressure will rapidly go up. We call it stage 2. Now we have to study first this phase. Look here, that as urine is coming up, how bladder is able to accommodate more and more increasing volume without increasing the pressure. The principle is Laplace's law. Laplace's law says pressure in a viscous is equal to tension divided by radius. I mean, the tension which is present in the wall, this is the tension, right? And this is the pressure, right? And of course this is the radius. The maximum radius, if you take the tension of the wall divided by the radius, that will determine what should be the pressure in the viscous. Now listen carefully. If you keep on increasing the volume here, then naturally tension on the wall will increase. If tension is progressively increasing and if radius does not increase, then intraviscous pressure should go up. But what really happens? What truly happens is that as volume keep on increasing, there's a little increase in the tension, but with even little increase in the tension, radius of the viscous start increasing. As tension is increasing as well as radius is increasing, so naturally there will not be significant increase in pressure. Is that right? This is Laplace's law. Now, question is that what determines the increase in radiation? One reason is that bladder wall has a very special quality which is called plasticity, biological plasticity. The concept of plasticity is that if a viscous is stretched, the increase in the tension of the wall is not maintained for a long time, right? This is a concept of plasticity. Normally what happens if you have, it is not elasticity, elasticity is different. In elastic, when you stretch it, there is increase in the tension which is maintained, but in plasticity, initial increase in the tension is not maintained. Now, first we have to talk about the very first thing. When you are taking the lecture, urine is coming into bladder, and bladder is progressively accommodating the more and more volume of urine without any significant increase in the pressure, at least in the initial stages, because it is progressively increasing its size. Now we have to go the very first information that how bladder size increases. One reason I told you the property of the wall of the bladder, that is plasticity. But another reason is neurological connections. Nervous system has some rule that when you are not urinating and you are accumulating the urine, bladder has to keep on increasing its size. Who will explain me how nervous system help the bladder to increase its capacity? Or yes please, you have no idea. Anyone? Feel free, listen carefully. Let me repeat this question. A person who is sitting in a lecture or in a office working and not willing to go and pass urine, kidneys are making urine, progressively urine is appearing into bladder. As amount of the urine with the time is increasing, pressure is not allowed to significantly rise in the bladder. One of the simplest mechanism is because bladder also keep on increasing its radius. Which neurological mechanism is responsible for progressively increasing radius of the bladder when you are not urinating, you are retaining and bladder is in the filling phase? Yes, anyone? Raise your hand. Of course, it's relaxation of smooth muscle, but what is the neurological role? I was about to be impressed. Yes. Anyone? Very good, sympathetic nervous system. You know, it's sympathy with you. You're sitting in a lecture and your bladder is getting more and more volume of the urine. Do you think you can attend the lecture properly when pressure becomes very high in the bladder? So thank God the sympathetic nervous system sympathizes with you and helps you to increase the capacity of the bladder. Now we have to see that how sympathetic nervous system works. I don't know why students keep on thinking about parasympathetic and bladder, but remember, first you have to fill it and then you have to evacuate it. Parasympathetic help in evacuation, but what helps in filling? That is sympathetic nervous system. That sympathizes with you. Is that right? Now we have to see how it really sympathizes with you. Right? Now, actually, you know, in L1, L2 level or L3 level, you know, there is sympathetic outflow from the lateral horn. All of you know that. Before that, I will tell you there are some sensory, you can say, these are sensations which are taken up from the trigon and there are sensations which are taken up from the body. Now these sensory systems, they are taking sensation to which part? Through the dorsal root. These are somatic sensations, right? Dorsal root, and from here, okay, these are the sensory pathways, right? Then I will explain how sympathetic nervous system really helps. Again, dorsal root, So first of all, you must know that from the bladder there is sensory output, and this sensory output from the bladder is acting as the input to the central nervous system. Is that right? There are stretch receptors present in the bladder, and especially they are very much concentrated in trigone and urethral part, initial part of urethra, right? They are giving the sensory information here, right? Now let's see how really sympathetic nervous system is activated. But before that, from here, sensory pathways take the sensations, yes, upward, and from here also sensory pathways take the sensations, yes, upward. Now these blue pathways which are taking the sensation upward, they are going to the pontine centers. There is a pontine center here related with control of micturition, and in midbrain also there are some centers. Usually midbrain centers are inhibitory for the micturition reflex, and pontine centers are stimulatory. These sensations are going up. They are consulting and giving the information that bladder is being filled to brainstem centers, and then they are going to the, what is this here? Cerebral cortex. And when this information goes to cerebral cortex, there you, actually this is on the paracentral lobule, medially, not laterally. There these sensations produce the conscious awareness of that your bladder is filling. Is that right? Now, as bladder is being filled, attention please, you are sitting in the lecture. Now listen, traffic of action potential from the sensory system is going towards the central nervous system in the sacral area. Number one, it will activate sacral reflexes, we will see how. Number two, this sensation is taken upward. Now, when it goes to the cortex, cerebral cortex is the seat of consciousness, awareness. You know that you are taking the lecture, you should not urinate right now. So it means that whatever amount of the urine is coming, you should accommodate that. It means there should be activation of some pathway which should lead to increase in the size of the viscous. Is that right? Actually from here descending pathways come. And descending pathways from the higher center which come, they stimulate, what was this? Sympathetic outflow. So they will stimulate, yes please, the dotted line is sympathetic outflow, right? These are sympathetic outflow. Now this sympathetic outflow which is coming from the lateral horn, actually from the descending pathways from here, from the higher centers, right? These pathways which are coming down, they stimulate these sympathetic fibers. Now, as time passes by, sympathetic activity is selectively to the, I told you yesterday, usually sympathetic activity is diffuse, but in some examples it is a little bit selective, right? But parasympathetic is usually selective, discrete. Now, the sympathetic activity will progressively increase. Now, what really happens? The sympathetic fibers, number one, they come to, what is this area? Detrusor. The sympathetic fibers will come to detrusor. And number two, some of the sympathetic fibers will go to, yes, internal sphincter. Now listen carefully. What really happens? You are sitting comfortably, but all this thing is happening automatically. That sensory input is going to the central nervous system about the bladder filling. You may become conscious if it is significant stimulation, or you may not be conscious if it is less than significant stimulation. But what really happens, central nervous system decide to hold the urine or still remain in the filling phase of the bladder. For this purpose, sympathetic outflow is increased. When this sympathetic outflow is increased, what really happens, right? That epinephrine, norepinephrine is released at where? In detrusor, and norepinephrine is released at, yes please, what is the sphincter? internal sphincter, right? Now, when norepinephrine is released here, norepinephrine here and norepinephrine here, it will act on which receptors, please? Yeah, these receptors are beta 2 receptors, and this will also beta 2 receptors. Beta 2 receptors are stimulatory receptors or inhibitory receptors? Inhibitory receptors. So what really happens? The detrusor will relax. So answer was basically, as time passes by, sympathetic activity gradually increases to the bladder and it keeps the detrusor relaxed and it increases the degree of relaxation in the detrusor, right? It's sympathizing with you, isn't it? At the same time, when they are releasing here norepinephrine, the receptor which is present over here, what was this receptor? Alpha 1. And receptor, of course, here is also alpha 1. Alpha 1 receptor is stimulatory or inhibitory? Stimulatory. So it means there will be stimulation to the internal urethral sphincter and there is inhibition of, yes, there is inhibition of detrusor. So detrusor is inhibited by progressively increasing beta 2 action and internal sphincter is tightened by progressively increasing alpha 1 action. Due to this reason, thank God, sympathetic system keep on sympathizing with you all the time when you are not passing the urine, and bladder keep on accommodating more and more urine and keep on increasing the size of the vesicles. Is that clear? Now, as I told you, as time will pass by, pressure will keep on, volume will keep on increasing. Whenever a volume will increase, sensory input will for a while increase until further relaxation occur and sensory input decrease. It means that basically, attention please, all the sensory input which is going from here, it actually fluctuates. How it fluctuates? Please try to understand it clearly. For example, when initial amount of the urine comes and urine reaches up to a significant amount, volume, right, sensory input will increase. That will increase the sympathetic output and it will relax. When it will relax at a new level, then naturally pressure will go down and sensory sensations will decrease. But after 1 hour or so, again volume will come and sensations will increase. So it means as time will go by, the burst of sensory input will appear again and again, and with the time this burst of sensory input to the central nervous system will increase in intensity and increase in frequency. That will increase in intensity and increase in frequency. Now, when this becomes significantly increased, then we have to talk about another pathway, and this pathway is, yes, there was a lateral horn here. This is anterior horn, right? Now look. Now, actually from here, from the lateral horn, this is again which lateral horn? Yeah, sacral, isn't it? Sacral, S2 and S3, lateral horn. From here, which fiber will come out? Parasympathetic. From here, the parasympathetic which come out, they have to go to detrusor as well as they have to go to internal sphincter. Parasympathetic have to come out and they have to go to the sphincter, internal sphincter, as well as to the, yes please, detrusor. This is parasympathetic outflow, right? The ganglia for the parasympathetic outflow are present within the urinary bladder wall, transmural, isn't it? Or intramural rather, intramural ganglion. And ganglion for sympathetic, which I did not show, they were hypogastric ganglion, right? Now, these are pelvic nerves with parasympathetic activity. Now, one thing which you have to understand, please, that sensations enter at sacral level and parasympathetic outflow is also at sacral level, but sympathetic outflow is at lumbar level. Of course, it's understandable. Sympathetic outflow cannot be from sacral level. Is that right? Now, what really happens, listen carefully, as I told you that when sensations enter into spinal cord, they give ascending pathways. But actually, there was one thing which I didn't tell you and I must tell, that when sensation enter, they also stimulate, yeah, what is this? Parasympathetic outflow. So what really happens, attention please, that when sensory input goes over there, you try to activate parasympathetic outflow. And if it was so, attention please, if it was so that whenever bladder fill a little bit, sensations go to the spinal cord, from the spinal cord sensory system directly stimulate the parasympathetic outflow, then naturally urination will occur, right? But normally it does not happen in adult person with mature urinary system and mature nervous system, right? He has to decide or she has to decide that socially is it acceptable or not to urinate at a particular time and particular place or not, right? So it means, listen carefully, that when progressively bladder was being filled, progressively sensations were increasing to the central nervous system, they were stimulating the local parasympathetic outflow as well as they were informing to the higher centers. This was the duty of the higher center, that if higher center decide not to pass the urine, then it is the duty of the higher center initially to progressively increase sympathetic outflow and keep the parasympathetic outflow inhibited. Is that right? It means that as progressively sensations increase to the central nervous system, lower sacral centers should communicate with the higher centers, right? With the pontine center, with the midbrain center and with the cortical centers. And information which should come down, because higher center know what is the right time and what is the right place and what is the conscious decision to urinate or not. If you are decided not to urinate, then higher center descending pathways will lead to progressively increasing sympathetic activity to the bladder and progressive inhibition of parasympathetic. Is that right? So filling phase will continue and evacuation phase will not start. Am I clear? Now, let's suppose that I have taken a lot of caffeine and I'm keep on giving lecture and lecture become very long. Now really pressure become very high. And if you still decide not to go to the washroom and you want to stay in the class, now the sensations for the voiding or feeling of the desire for the voiding increases progressively. Eventually, central nervous system, higher centers decide it is not enough to just stimulate the sympathetic, because if sympathetic nervous system is fully stimulated, is that right, and it has been fully stretched out and it is significantly inhibited, but there is so much urine now, maybe about 350 ml or around 400 ml, it is really very badly stretching it now, because further relaxation of the blood, further increase in capacity cannot be achieved. This is the time when you really feel very uncomfortable and there is a strong urge to pass urine. If you decide still not to pass urine, then what will happen? Now, listen carefully, then you will consciously hold the urine, and for that purpose, you have to now stimulate external urethral sphincter, right? And you are just praying that lecture should be finished. Is that right? Now, it means another system is activated by the descending pathways, right? For this purpose, what really happens? That, now listen carefully, this is interior horn cells, and which are present where? Again in S2S3. Now, this dotted line was sympathetic outflow, but this is somatic outflow. What is this outflow? Somatic outflow, and this is going out through which nerves? Yes, pudendal nerves. And through the pudendal nerve, these fibers will come and they will stimulate, yes, very bad, not internal. Which one? They will come and stimulate external urinary urethral sphincter. In the same way, these fibers, they will come out and they will stimulate, yes please, external sphincter. Now this is a situation difficult for females and easy for males because they are longer urethra, but what really happened, they are trying to hold the urine, and this is a very conscious effort. You are standing, he knows how to stand, he is standing in such a way that the sphincter is very tight and maybe pelvic muscles are also very tight. And what is happening, that not only he is trying to have maximum sympathetic activity, and this is a problem now with the higher central nervous system. Higher central nervous system, what it is doing? Number one, they are keeping the maximum outflow of sympathetic, they are keeping the minimum outflow of parasympathetic, and they are keeping now maximum outflow of somatic efferents. Is that right? Am I clear? So the pudendal nerve. Now what really happens? That alhamdulillah lecture is over. If lecture is over, doctors have rushed to the washroom. Now his central nervous system, he has a sigh of relief, bolted from inside, sit on the seat. Now he feels very happy, central nervous system. It's the right place and the right time to void the urine. Micturition should be started. Now we have to see how the micturition cycle will start. Who will explain it to me? Up to now we are holding the urine. You see, I don't know, somehow students always keep on remembering how to pass the urine, but it's more important to hold the urine first. And then, of course, you should know how to pass. Now we are going to the urine passing stage. Now central nervous system decide, higher centers, that socially the situation is acceptable, it's the right time, right place, and what really happens? Now descending pathways come down, in which especially a role is played, information by the cortical center is given to the pontine center. That congratulations. What is congratulations? Yeah. That he is in washroom comfortably and there is no line outside. Pontine centers are informed that now we were talking about that Dr. Rafiq is in washroom. He is very comfortable over there. Now how he knows he is really comfortable? It is from his cerebral cortex, because all the social matters and cognitive thinking and level of stress and level of comfort, all these are determined by the functions of the cerebral cortex. In this particular case, the role is played by number one, inferior orbital cortex, which socially decides that are you at the right place and at right time to pass the urine or not. Number two, final decision is made by paracentral lobules. From here the descending pathways come down, and these descending pathways, cortical descending pathways, they will influence the centers in the brainstem. Especially they will facilitate the pontine center. When they will stimulate the pontine center, when these pathways will stimulate pontine center, these pontine centers will facilitate the lower center to pass the urine. Now how these pathways will work? Number one, they will inhibit sympathetic outflow to the urinary bladder. Is that right? Number two, as these pathways are coming down, they will stimulate, parasympathetic outflow. Now, the parasympathetic outflow from S2 and S3, it is being stimulated from the higher descending pathways as well as, please note it, as well as parasympathetic outflow is also stimulated by the local spinal reflex. Now, compare the previous situation and present situation. Previously, when he was holding the urine, what was really happening, that sensory input was going to the central nervous system, and in the sacral area, spinal reflex was trying to activate the parasympathetic. But as socially the situation was not acceptable and he was planning not to void the urine, so when central nervous system at the higher level, cortical level, decided not to pass the urine, then what really happened, that pontine centers were inhibited and sacral centers, parasympathetic outflow was also inhibited. But once he is in the right place and he is comfortable to pass the urine, the descending pathway alters its behavior. The descending pathway inhibits the parasympathetic sympathetic outflow, inhibits the Sympathetic outflow stimulates as well. What is this? Pontine stimulation. Again, cortical area stimulates the pontine centers. Pontine micturition center inhibit. What is this? Sympathetic outflow and stimulate or facilitate parasympathetic and inhibit external urethral system. And it inhibit the nerves, neurons which are going for external urethral sphincter, which is through pudendal nerve. Now let me go into step by step. All these things do not occur simultaneously. This is called nucleus of Onuf. This is nucleus of Onuf. So we can say external urethral sphincter is controlled by sacral nucleus of Onuf. Some say that external urethral sphincter is slave of the Onuf. Now, let's go into step by step. Step number 1. Yes, what is this? Higher centers decided that it is the right place and right time to pass the urine. Higher cortical centers. Right? Number 2. They stimulated, yes, pontine micturition centers. Pontine micturition centers. Next, pontine micturition center will do multiple things. Now, what things it will be doing? Number 1, pontine center, it will be doing multiple things. Number 1, it will relax the muscles of, it will go down, it will come to the somatic outflow, right? It will go to the pontine centers, will come to the somatic outflow, right? And when they come to the somatic outflow, at that very moment, and S2, S3 and S4 outflow, which is somatic, they basically inhibit the somatic outflow. When the somatic outflow is inhibited, it means muscles of pelvic floor and external urethra are relaxed. External sphincter of the urethra is relaxed. So what really happen? Relaxation of muscles of pelvic floor, and external urethral sphincter. Now, at the same time, it inhibits, yes, what's there? Inhibition of sympathetic outflow from which area? L1, 2, 3. Is that right? Now, after that, what really happens? You know, as soon as pelvic floor muscles will relax and external sphincter will relax, what really happens? Some urine will trickle into most proximal part of urethra. Some urine will trickle into this part of trigone and urethra. Now this extra urine which has come into this area is extremely rich in sensory nerve endings. So what really happens? That as soon as he relaxes his muscles, little bit urine trickles into initial part of urethra, and it is very, very rich in sensory nerve endings. There is a very heavy firing of the sensory nervous system. Right? Now these fibers are going to the central nervous system through two routes. Some of these fibers are going along the pudendal nerves, and some of these fibers are going along the sympathetic nerves. Right? It means that sympathetic, now these fibers, sensory fibers, will be strongly stimulated, and they will go back and they will have a strong reflex stimulation of parasympathetic. At the same time, higher descending pathways are also facilitating parasympathetic. So we can say there is local reflex, local sacral spinal reflex for parasympathetic stimulation, which is now being facilitated by the higher centers. Previously this was being inhibited by the higher centers, now it is being facilitated by the higher centers. Again, Previously, when he was holding the urine, sympathetic outflow was facilitated. When he was holding the urine, sympathetic outflow was facilitated and parasympathetic outflow was inhibited by the higher center. Now, higher centers have decided to void the urine, so sympathetic centers have been inhibited and parasympathetic centers by the higher descending pathways have been facilitated. At the top, as he consciously relaxes his pelvic floor and little bit urine trickles into initial part of urethra or trigone, there is extra stimulation to this area. The strong sensory input lead to further very strong stimulation of parasympathetic outflow. Then this parasympathetic outflow will be going very powerfully. And naturally, when parasympathetic fibers will come to detrusor, they will release acetylcholine there, and that acetylcholine will lead to contraction of detrusor. There are stimulatory receptors over here. At the same time, some fiber will go to internal urethral sphincter, which will relax, because parasympathetic receptors which are present on the detrusor, they are stimulatory, and parasympathetic receptors which are present on the internal sphincter, they are inhibitory. So what really happens that now detrusor is contracting, intravesicular pressure is going progressively high, and what really happening with this, that external sphincter has already relaxed. So urine will be pushed through the urethra and he will start voiding. Is that right? So micturition will start. Again, let me repeat the step. Step number 1, when he has gone to a place where he can pass the urine comfortably, right? What will happen? We have to compare what is happening before that event and what is happening after that. Before he sat on the seat, he was holding the urine. What was happening at that very time? At that very time, before, when he was holding the urine, sensory input was going, right? It was trying to reflexively activate parasympathetic outflow, but parasympathetic outflow was kept inhibited by the higher centers, right? And of course, information was going to the higher centers, and conscious level was determining it is not the time to pass the urine, and higher centers, cortical centers, right? They were inhibiting the pontine micturition centers, and there was overall stimulation of sympathetic outflow and inhibition of parasympathetic outflow. And if there was strong pressure to pass the urine, but he was not deciding to pass the urine, then of course there will be strong output going through the pudendal nerve for which muscle? External urethral sphincter, to extra effort to hold the urine. But as soon as he sat down on the seat, the central nervous system decided it's the right place and right time to pass the urine. Once this decision has been made, then descending pathways will alter their firing. Now different type of descending pathways will fire. What they will do, number 1, they will stimulate the pontine centers. From the pontine centers, further descending pathways will come. They will inhibit the sympathetic outflow. They will inhibit also the outflow, somatic outflow going to the pelvic floor muscles and external urethral sphincter. Due to this reason, little bit urine will trickle into initial part of urethra and pressure in trigone will go up. This area is extremely sensitive to the presence of urine. So a very strong traffic of action potentials will reach to sacral. Now sacral spinal reflex will be activated, right? It will be locally stimulating strongly parasympathetic outflow, and parasympathetic outflow is further facilitated by the descending pathways. Due to that reason, parasympathetic system will stimulate the detrusor, and at the same time there is a relaxation of internal sphincter, and external sphincter is also relaxed. So he will start passing the urine. Once he has completed the voiding, the urethra should be, whatever little amount of urine is present in the urethra, that should be also cleared off. Of course, the last part of urine which was present into this area, that was pushed through detrusor activity. But the last amount of urine which was present in the urethra, how it is expelled? In female, the urethra is short and wide, so it's very simple. In female, it's the gravity which helped to clear off the urethra. But in males there is a muscle which actively contract and they expel and clear off the urethra. What is the name of that muscle? Yes please. Who knows the muscle? Yes, Mr. Alim, Mr. Amir, Abed, anyone? In the male there is a muscle because the urethra is quite long, so it has to be pressed by some muscle so that it can squeeze the last part of the urine. Yeah, bulbo cavernous, that's good. Bulbo cavernous muscle. So there is a little bit, and this is conscious stimulation, right? And that stimulation, you can say, clears off the last drops of urine from the urethra. Is that clear? Dr. Rafiq, are you comfortable? Clear? Now, so this was micturition cycle. After that, what will happen? He will come out of the washroom and next filling stage will start. There is no fun in repeating again. That what will happen? That external sphincter will be tightened and then internal will be also tightened, and with that there will be relaxation of detrusor, and relaxation of detrusor and contraction of internal sphincter will be mediated by progressively increasing sympathetic overflow to this particular area. Any question up to here? Is it clear to everyone?